important information for our veterans and their families and all interested people out there about issues affecting our veterans, concerning our veterans, and of importance to our veterans.
That's a fact, Jack.
And we've got today, again, our special presentation of Heal the Warrior, Heal the Country with Dr. Fairchild, and he's a renowned psychologist.
You bet.
Cue the music, Vince. We like some Soldier Hard. Hey, it is. We're here. Go ahead, Glenn. I'm stepping on you. Sorry. It's Heal the Warrior, Heal the Country with Dr. Scott Fairchild of Baytree Behavioral Health.
Yeah, go ahead, Dr. Fairchild, and well, I'm looking at some notes you handed us here, and give us an idea about what we're going to cover today for the folks.
Absolutely, we're all on the road to recovery, and in one way, shape, or form. And I just wanted to share with you a little bit today. A lot of people say, well, what are those symptoms of PTSD? I mean, what is PTSD all about? I got some folks that come in and say, I think I got that PSTD, or I got the PCD, whatever it is.
Yeah, you've heard it all.
I've heard it all. And so let's talk a little bit about some of the symptoms that come up with PTSD. Obviously, it's after experiencing a trauma. And a trauma kind of overwhelms our defenses. It's something that we can't keep away. It kind of breaks through as old Freud said, it breaks through the stimulus barrier. And when it does, it hits us, and it hits us hard. So we end up having a reaction, but it's so important to know that that reaction is a normal reaction to an abnormal situation. And many of us are going to encounter those things in our lives, whether they be a car accident or robbery or rape or death of a loved one. Or
those would be
combat.
traumatic events for sure.
They absolutely are. And then we're going to react. And sometimes we feel a little bit out of sorts. We feel a little bit crazy when we react in situations like that. But it's so important to know that is our natural way of attempting to heal. And so we can have physiological reactions. We can end up having difficulties with sleep. We can have fatigue. We can be hyperactive and wired. We can have pains throughout our body. We can have headaches, dizzy spells, appetite changes. We can have a lot of physiological reactions when we've experienced a trauma. And we may think it's coming from something else or our body's falling apart.
Well, let me jump in here because a great example would be this last week, AVET Project assisted with Operation Surf coming in from California. They brought some warriors in from Brooke Army Medical Center, and AVET Project provided half a dozen or so veterans that are combat disabled, whether it's a physical or mental disability, and it was about teaching them how to surf, getting out of their element a little bit, having some fun. But it's amazing, Doc, how many of these guys and gals really aren't even aware of what they may be suffering from, even though they're going through the Warrior Transition Unit and all this stuff through the DOD and some of them through the VA. And PTSD is obviously prevalent, particularly in those that are serving in combat operations, but traumatic brain injury and all that jazz. But they're not even really aware of what their benefits are and how to engage providers like yourself, because they may think like a good friend of mine, he's become a good friend down in Palm Bay, lost his leg, Navy SEAL, and he just had his leg lopped off in January, but he wasn't even aware of what his potential benefits were. He thought when he left the military, Glenn, gosh, they've taken care of me, they set me out on a plane to get everything that I need, but it hasn't turned out that way.
Yeah, as we all know, unfortunately, particularly with the more severely wounded warriors, when they get out of the military, they are grossly uninformed about veteran benefits and what they can qualify for, which can help some of their problems that they're experiencing.
That is so true, and so many times they are also unaware that they actually are suffering from post-traumatic stress disorder.
And you, as the leader and founder of Baytree Behavioral Health, that's something that you specialize in. Even, I know you cover the general population, but you also target that audience. I mean, that group of, that population of people
We do. We certainly do. And, we'll find that they experience a lot of emotional reactions. They'll end up, individuals with post-traumatic stress will have flashbacks, which literally take you back. It feels like you're reliving the situation. Even if it was 10, 20, 30, 40 years ago, it just seems as real as if it were yesterday. And they'll end up and complain of irritability. A lot of times the spouses and other family members will complain of irritability, or that person across the counter who gets chewed out when the hamburger is a cheeseburger and not supposed to be.
Yeah.
And there's an enormous amount of anger and a lot of anxiety. And also, the individuals with PTSD feel vulnerable. They feel very vulnerable, and they feel very overwhelmed. And so it will have effect on productivity as well. They can't maintain a job, or they go from one job to the other. So it's really important. One of the things we came up with for one of our groups is being certain and being, understanding that just because an individual suffers from post-traumatic stress disorder, it does not mean that they themselves are PTSD.
Well, that's interesting.
Yeah, we try to separate
there is
that.
a separation, okay.
There is a separation, and one of the things we've been able to do is kind of refer to that as Mr. or Ms. PTSD, who sits on their shoulder. PTSD is kind of like an uninvited guest in your house. After 3 days, they kind of start to smell like fish. and so, the PTSD pops in and out when it wants to, and then the individual who has it feels guilty about yelling, screaming, throwing things, and the like. So we try to separate that out. In fact, one of our families called their Mr. PTSD Mr. Diablo. And, his wife will say to him, "Looks like Mr. Diablo is out today." And it's just a little word check, but it makes a difference. So he can pull back a little bit and say, yes, maybe I'm going in the wrong direction. And so we've actually coined a little statement, and we read it in group. Right before we ask our veterans and our folks who have experienced trauma to respond.
Share that with our audience. Let us in on that.
It's actually a letter from PTSD to the person who's suffering. And I caution those of you who have experienced trauma, when you hear this, it's going to make you angry and upset. So, just
This
understand.
is from PTSD to, for our purposes, the warrior, the warfighter, or the family member that's affected.
And it says, "Dear friend, even though it's not been long, I've come to visit you once again. I just love to see you suffer, mentally, emotionally, socially, and spiritually. My visit will again make you anxious and irritable, so everything and everybody will cause you to feel uncomfortable and disoriented. I want you to be confused and depressed so that you can't think clearly, and you'll hate everybody, especially yourself. I want you to feel guilty and remorseful for the things in your past. I want you to feel angry and hateful towards the whole world and the way you are. I want you to feel sorry for yourself and blame everyone but me for your predicament. I want you to stay fearful and paranoid for no reason at all. I want you to live inside your dreams so you wake up sweating and are unable to go back to sleep. I thank you for the countless things you've given up for me, and for the friends that you've ignored because you and I became so close. I'm most grateful for the family you sacrificed so that you and I could be together. I'm happy that we were able to pass this on to your wife or ex-wife and children when they tried to actually stand by you. Thanks for devoting your life to me. But do not despair, because I will not desert you, as others have. For as you continue to suffer things others have, I will become an even greater part of your life. You can depend on me to keep you in an eternal hell. I will be your only friend forever, yours, and with affection, Mr. or Ms. PTSD. Ouch. That one hurts.
No kidding.
Yeah, we're talking with Dr. Scott Fairchild on Heal the Warrior, Heal the Country, special segment that we bring to you monthly. And again, that letter that the doctor read was from PTSD to the sufferer of PTSD. And
So don't get offended, folks, and you mentioned that.
Don't get personally offended, and take the flip side of this, because that's exactly the way this is focused. Is the flip side of this is what you, if you're experiencing PTSD, are likely having issues with.
That is correct, and what we'd like for you to do, if it's irritated you and frustrated you and you have suffered from trauma, we'd like you to grab a pen and a paper and sit down and write a letter back to Mr. PTSD.
Give it to Mr. PTSD.
Now you can be loose with your language in that if you wish, but write a letter back to Mr. PTSD or Miss PTSD, and you tell him or her what for. You tell him.
Doc, you're a career Army man. You're a licensed practicing clinical psychologist at Bay Tree Behavioral Health. This is a tool you've developed and it's effective?
It's been effective. It's been used also in the residential treatment program that the VA offers in St. Petersburg. And it's been used very effectively. Our young veterans really appreciate it. It's a way for them, when stimulated and when upset by this letter, to write back and get some of those emotions out that they've held inside for quite a while.
So you're intentionally poking at him. I'm Mr. PTSD poking at the warrior. And it works, I'm presuming, for family members as well.
It does. It really does. And family members are able to understand, my warrior there, sometimes when he's ornery, angry, and throwing things, I have to realize that that's my husband. Yes, he's a little different than the guy I married after his combat experiences. Yes, she's a little different when she came back from combat. However, I have to make sure that I don't equate my loved one with PTSD. They are not PTSD. It is an illness, just like a person who has cancer is not cancer. They have cancer.
It's a good point, Glenn.
Excellent point. I really like the part of this, I'll call it therapy because it seems like therapy to me, of having them write back and respond to this letter, because it makes them think about all these things that are in that letter from Mr. PTSD to them, and can I really write back and say that that's not true when it might be true?
So I'm sure there's some colorful letters back to Mr. or Mrs. PTSD.
There are, in fact, some of them are two-word responses with an exclamation point.
Fill in the blank there, people.
That's right. And other ones, are very lengthy and very meaningful. And I've got to share with you, one of our veterans who spent some time in the residential treatment center, he said he came back from there and he got home, and at dinner he called his family together, and after they finished dinner, he read the letter from PTSD to him, and he read his response back, the 2-page response that he had written back.
2 pages. Wow.
2-page response. And he said there were tears around the table because his family came to understand, to better understand his condition and why he was the way he was. I also had a veteran who is a Vietnam veteran, a pilot, who flew in Vietnam and suffered a lot of PTSD. He actually called his grown daughters back together and talked with them about his issues, his experiences, and actually apologized to them on behalf of Mr. PTSD, who happened to be living with them in their household for many, many years.
I like the idea here because you're getting the warfighter out of their head, a little out of their soul, addressing what I and our producer seems to think is like Satan. I mean, PTSD is not from a happy place, and yet it exists within their minds and hearts and souls. I'm sure their very being, and yet for them to be able to channel whatever feelings they have towards PTSD in that fashion sounds pretty productive.
It has been very productive, and in fact, we will have some of our veterans refer to these things as their demons. They actually refer to my demons from the war. And they feel very uncomfortable when they come out. It may be very explosive. It may be cutting someone off on the road, or it may be, being at a store and someone cuts in line and they make a scene and they yell and they scream. And then they feel an enormous amount of remorse after that. So their emotions are going up and down. So it's very important to designate a time. I often say emotions are a God-given gift. Our opportunity, our radar, you Air Force flyers over there will understand they're like our AWACS system, that big disc in the sky that spins around and around and warns us of potential difficulties. And so our emotions are a gift to us. They're actually our radar, our sensing that says something's not right. So when we're angry, when we're anxious, when we're sad, when we're frustrated, we need to look at what's not right and make some adjustments.
Wow, I hope you're all listening to this. This is awesome stuff. You're only going to hear it on American Warrior Radio during Heal the Warrior, Heal the Country segment with Dr. Scott Fairchild, who practices at Bay Tree Behavioral Health. Real quick, Doc, how can people get a hold of you in your practice?
They can get in touch with us at 321-253-8887. or visit our website, baytreebehavioralhealth.com.
BayTreeBehavioralHealth.com. So if I'm living in Illinois
Correct.
and I'm listening to American Warrior Radio, are you able to consult with them?
They're able to visit our website. We do follow a lot of patients on a program called VSEE, VSEE. It's very similar to Skype, but it's protected by HIPAA, by all the rules that govern
Awesome.
our communication. So we are able to make connections with individuals from around the country, and we do have a lot of folks that come in for evaluations
Yes, you do.
from around the country, and we continue to follow them after they go back home. We also prefer for them to have a therapist locally, so that if they have an emergency, they can be seen there. But we do follow folks from around the country.
And sorry, I didn't mean to cut off the end of your talk there. Would there be a certain timeline that people should look for to experience these common responses to traumatic events, or Mr. PTSD jumps out of the closet at them?
You know, that's a very good question, Glenn, because diagnostically, by the diagnostic manual, we're looking at if those symptoms last over 30 days. You know, if we have a bad experience, we witness a car accident, or we're in a car accident, and we have some symptoms like this, the physiological symptoms or the emotional symptoms, and it dissipates or goes away after 30 days, we might consider that an acute stress reaction. But if it lasts a little longer than that, we definitely want to look at the diagnostics for post-traumatic stress disorder and say, uh-oh, it might be time to go get some help from someone. And so you're absolutely right in questioning the time frame. It is important to take a look at that. Now, it's also important to realize that some individuals who may have put this away in the closet for a long period of time. And how do we put it away in the closet? We can numb it with alcohol. We can numb it with drugs. We can keep busy. A lot of our Vietnam vets work 3 jobs to avoid it for 40 years.
Is that the common vernacular, I guess, self-medicating? Is that what you're kind of describing?
Absolutely, and one can self-medicate with work by keeping busy to avoid. And subsequently, we see a lot of individuals when they retire from all of those jobs, all of a sudden, these symptoms come up, and I've referred to it as a tsunami wave. It's like a tsunami wave of emotions that throughout your life has been chasing you, and when you stop and sit down and retire, it comes and hits you. And so I have so many Vietnam veterans sitting in my chair and saying, you know, this stuff happened 40 years ago. Why am I dreaming about it? Why am I thinking about it? Why is it as real as it was yesterday?
And while they're still working, brief our audience a little bit on some of the effects on their productivity while they're working these 1 to 3 jobs, as it were.
Well, absolutely. And usually we see that individuals who have experienced trauma will try to find jobs in which they can isolate and work on their own, like construction or working as a tree surgeon or working at the post office. Actually, the first 3 killings in the post office, we're all familiar with the vernacular of postal. The first 10 killings in the post office were committed by Vietnam veterans.
Wow, I didn't know that. Yeah, going postal, huh?
Yeah, absolutely, and that's kind of where it originated. So working in an isolated environment where they don't have to interact too well with others, and again, there's a difficulty with the ability to concentrate. There may be increased errors. There may be increased absenteeism. And you'll find people sometimes overworking and other people underworking. You may have problems with substance abuse in the workplace. And again, don't get me wrong, we're not labeling individuals with post-traumatic stress disorder as slackers and non-workers. What we're saying is that some people may experience these symptoms, just like not everyone with PTSD goes off, buys a pistol, and shoots someone. It's important to realize that as people get help and get therapy and become aware of coping mechanisms and coping skills, individuals with PTSD can and do survive, and many live productive lives and redirect their energy into those productive lives.
Yeah, and on the VA side of the house, the rating percentages from 10% on up to 100% for PTSD are dependent upon the effects on social and industrial capacity.
That is true. It's the ability of the veteran to be able to function. And again, In this day and age, when we see so many young warriors who have had 2, 3, 4, and even 5 and more deployments, we realize that the impact can be tremendous. And we realize also that once wounded, you're kind of drawn back into a combat situation. You're drawn back into the military where you know the rules. It may seem chaotic to the innocent bystander, but when you know the rules over there, sometimes, I've had a number of Marines, Army, who just want to go back. They're drawn back. They're drawn back to the excitement, the exhilaration of a combat environment. Subsequently, their emotional schema takes another hit. And you get folks that are now retired or separated from the military who have trauma after trauma after trauma, and do have a very difficult time entering into an occupational environment. Some of them are getting together to form their own occupation, as we've talked about in previous shows, opening up the Battle Brothers Bait Shop.
How's that going?
It's going along. It's moving forward. We've got a number of people, occupational therapists and others, and some donators who are helping these young men move in that direction.
And I want to talk about a couple quick things here, because man, the time just flies, Glenn.
I know.
We never have enough time here. But we were talking about, you and Glenn were discussing the effects on productivity, and you brought out some really good points. And I think it's good, obviously, for the person affected by PTSD, the warfighter or the family member. But what about the employer or the supervisor? Those are good watch signs, yes?
They are very good watch signs, and we always give a lot of credit to individuals in the community who are willing to hire a vet. Most veterans will say, hey, I appreciate the Jumbotron moments and the recognition, but I really just want you to look at all the talents and abilities that I have and welcome me back and integrate me into the community because, hey, you depended on me to protect you and our country. And so I have skills. I have knowledge, skills, and abilities. I want to be recognized. I want to be integrated. I want to take those leadership skills and put them in the workplace. So we genuinely appreciate work environments, leaders, and managers who say, hire a vet, bring them back. Let me help them. If they're having some difficulties, let me work with them a little bit because, once they focus, they're going to be super troopers, just like they were on active duty.
Exactly.
That's so important. It's one of my key points, and that's that just
bring that up a lot.
because somebody might be diagnosed with PTSD does not mean that you kick them out of the world. They can be a super trooper for you in your business, and likely will be. So it's not something to mark them with. It's a problem they're having to deal with, and there's ways to deal with it, and the doctor's covering some great ones today.
And you mentioned, and we're on the same wavelength. I love this. I'm on the same wavelength with a PhD doc, man. This is cool because you talked about integration, which kind of dovetails in with PR&R, AVET Project's Project Recuperation and Reintegration Retreat Program for returning combat vets, which you are a lead mental health facilitator for. Okay, that's something we're offering, alternative therapies. Just briefly, we got 30 seconds. Can you give us an idea, rather than taking pills, what can you offer them?
So important to use some of the natural healing methods, and we have a lot of those that you'll find on our website also. In addition to that, the PR&R, the retreat is so important. We can do massive amounts of healing in a short period of time. I know last year we took quite a number of vets out on a cruise. They got so much. They got chiropractic, they got massage therapy, they got individual therapy, they got natural healing from our therapist out in Oregon. They got so many things packed into one weekend, and they got to pet the dolphins as well. So they really, and they learn from each other, and they, just gravitating to each other. What an opportunity. So we need your support in our community. We need you to donate to AVET so that we can get more of these retreats going for these individuals, so we can help to reintegrate them into society so that they can become the people who have protected you. They can be thanked for their service, and they can continue to serve.
Awesome. Well, we're out of time as usual. Thank you. Will you set your calendar, mark your calendar, last Saturday of every month. It's Heal the Warrior, Heal the Country with Dr. Scott Fairchild. And we got to cover this, Glenn.
Yeah, Veterans Crisis Line, 1-800-273-8255. 1-800-273-8255 for veterans. Press 1. And as always, don't forget, think of that.